What exactly is a personality disorder? It's a term that refers to enduring patterns of cognition and inner experience that markedly diverge from what is considered normal within cultural expectations. These disorders are characterized by their pervasiveness and inflexibility, aspects of a person's character that become so ingrained they deviate substantially from the average behavior. This often results in difficulties in social interactions, relationships, and an overall reduction in life satisfaction. The intriguing complexity of mental health becomes evident when one tries to identify a personality disorder, as these characteristics are significantly embedded in an individual's personality. So you may be keen to know, what exactly are the signs and symptoms of personality disorders? They can indeed differ, but there are certain things that often stand out. One of the most common signals is a struggle to form and maintain relationships. Individuals with personality disorders often find it challenging to build and keep meaningful connections with others. Another symptom is issues relating to self-identity. This can manifest as a distorted sense of self or a lack of a stable self-identity. Another major sign is impaired emotional regulation. Individuals suffering from personality disorders may find it extremely difficult to manage their emotions and react appropriately in different situations. Maladaptive behavior patterns are another significant. These are continuous behaviors that are not in line with social norms and can result in social or occupational dysfunction. Cognitive distortions, that is, twisted thinking patterns and perceptions about oneself and others, are common symptoms seen in individuals with personality disorders. And lastly, in some cases, a sense of impulsivity or a feeling of chronic emptiness may also be evident. Each of these signs and symptoms is a potential indicator of a personality disorder. The categorization of personality disorders is neatly structured into 3 primary clusters, as outlined in the Diagnostic and Statistical Manual of Mental Disorders. The first cluster, referred to as Cluster A, consists of disorders that are generally characterized as odd or eccentric. Notable examples of these are paranoid, schizoid, and schizotypal personality disorders. Moving on to Cluster B, this group is composed of disorders that tend to display dramatic, emotional, or erratic behavior. These include antisocial, borderline, histrionic, and narcissistic personality disorders. Lastly, we have Cluster C. This particular cluster is marked by disorders that are predominantly anxious or fearful in nature, and it includes avoidant, dependent, and obsessive-compulsive personality disorders. So what contributes to the emergence of personality disorders? The explanation is multifaceted. It frequently involves an interplay of genetic influences, environmental circumstances, and neurobiological elements. Experiences during the formative years, including trauma or inconsistent parenting, can play a significant role in fostering specific personality disorders. So, let's talk about prevention and early intervention. It's all about identifying potential problems early on, fostering supportive environments, and addressing risks before they become serious issues. This includes recognizing and treating mental health issues in children at an early stage, offering education support for parents, taking care of trauma and adverse childhood experiences, and encouraging a healthy social and emotional upbringing. Discussing strategies for treatment and management, one can perceive it as a multifaceted endeavor. The process is typically of a long duration and may include psychotherapy, medication, and fostering conducive environments. Various therapies under the umbrella of psychotherapy can be utilized. Dialectical behavior therapy, cognitive behavioral therapy, or even psychodynamic therapy. Certain instances might necessitate prescribing medications to manage specific symptoms. It is equally critical to establish a steady and nurturing social and familial environment to handle symptoms effectively. Let's underscore this vital point. Despite the challenges, individuals with personality disorders are fully capable of leading fulfilling, meaningful lives when with appropriate treatment and support. The key here is early intervention and a comprehensive treatment plan that is specifically tailored to the unique disorder and individual needs. This is the cornerstone for positive outcomes. Should you or someone you know may have a personality disorder, seeking professional help from a mental health provider is not just recommended, it's essential. Wrapping up, personality disorders are intricate mental health conditions distinguished by continual patterns of behavior, cognition, and inner experiences. These disorders can lead to challenges in social assimilation, relationships, and overall contentment in life. However, with early intervention, adequate therapy and support, individuals suffering from these disorders can experience a rewarding. This emphasizes the tenacity of the human spirit and underscores the significance of comprehension and empathy in our dealings with others.